I'm Mary Ward. I'm the president of McLeod Addictive Disease Center. We're based in Charlotte, North Carolina. We serve a little over 2,800 patients at any given point in time with medication-assisted treatment for opioid use disorder, along with outpatient and adult residential services for substance use disorders. And I've been in the field for a number of years and have always seen community-based behavioral health programs allowing patients to use tobacco. And we never really addressed that. I reached out, had conversations with partners and said, you know, we've got to do this. It's time. And so with Mecklenburg County Public Health, we sat down and figured out what needed to happen to really change the environment. And we know so much more now about the impact of tobacco use on a patient's overall health, not to mention their success and opportunity at sustained recovery or disease remission. I was very fortunate that Mecklenburg County Public Health sent me out west to a conference to sit with other behavioral health providers who had gone before me and successfully done this work. And the first thing I heard from those programs out west was their census didn't drop. Work also began with other peers of mine across 11 counties around the Charlotte-Mecklenburg area. So the Tobacco Free Recovery Coalition started bringing together other community-based behavioral health providers, and we started talking about how we leverage resources collectively. In February of 2020, we actually wrote our policy to become tobacco-free and implemented that effective January the 1st of 2021. We started leveraging opportunities for training our staff, getting them ready clinically to integrate nicotine treatment into our modalities. And we learned that overarchingly, patients want tobacco treatment, they want help for nicotine use, and it's up to us to deliver that. And it is a journey. It's not a straight line. There's a lot of curves in this process. And I think that's important for us to remember what our patients go through and what we go through as organizations. And I think as leaders, we have to pay attention to what's happening in our organizations and where we are with our patients. Because communication was very important throughout this roughly year-long process that we made to become tobacco-free. We leveraged partnerships to have signage about Change for Life in our lobbies, printed for our patients and available so that everyone knew this is why we are tobacco-free. I learned a lot through this process about the power of why, because we've not seen significant decline in our census. In fact, our residential services have actually had greater census than they did pre-policy rollout. And I think it's the holistic care and the approach that we take now to support patients through this process. But I'm really excited to see the impact this has on our patients, because I've been to our locations over the last 6 months and stepped outside to take a deep breath. And it is an opportunity to breathe easy. It's not easy work, but it's the right thing to do.